One of the procedures that patients have often heard most about is liposuction. And liposuction has actually changed considerably over the course of the last 15 years. 15 years ago, most of the patients underwent a procedure which was bloody and resulted in nerve changes and bruising and swelling which was prolonged. Nowadays, patients typically undergo what's called tumescent liposuction. And tumescent liposuction refers to the fact that once the patient's asleep in the operating room, the first thing we do is inject fluid under the skin, which helps to separate fat cells. It makes it a less bloody procedure with less neurologic injury and often results in a smoother skin than we started off with. Patients also have less deformities post-operatively after the tumescent procedure. Now, liposuction really isn't a treatment for obesity, but most of the patients that we see have problem areas where they've tried through diet and exercise to lose weight but have been unsuccessful. Many times these patients are pre-programmed, if you will, not to lose those fatty areas until they were absolutely at their thinnest and most tired of exercise. And many of those patients lose the incentive to want to continue to exercise and diet at that point. Through liposuction, we sort of reshuffle the cards so that those patients will tend to gain weight and lose weight more evenly across their whole body rather than having these problem areas which persist. Patients after liposuction surgery are in compression, and that means that we put them in a suit which helps that skin to remodel and diminishes the amount of room for fluid to accumulate under the skin. It also helps with fat cells that haven't been suctioned out to make them smooth and the contours regular rather than having areas where there's lumps or bumps associated with the liposuction procedure. Patients go home the same day, even if we do multiple areas of liposuction. And many times we do treat patients in multiple areas, including the abdomen, thighs, knees, upper arms, and sometimes even their neck. One set of patients that we see commonly come into the office are at what we call a borderline between needing an abdominoplasty, which is essentially removal of skin, and needing liposuction, which is essentially removal of fat. Oftentimes those patients may or may not require skin removal, but my tendency is to want to start those patients with liposuction to see whether we can get that skin to remodel in the way that we want it to. The other group of patients that we commonly see are women who have a small pooch over their lower abdomen, which they've been unable to lose despite aggressive diet and exercise. Those patients are often frustrated by the fact that those changes aren't ones that they can effectuate with diet and exercise, and we can in a short 1-hour procedure doing liposuction for those patients. Oftentimes those changes are permanent, and those patients really then see the results of that diet and exercise in a way that they never did before.